situation in Gauteng around COVID-19 still seems to be getting worse and worse. Yesterday around South Africa, 297 people were reported to have died from the disease. There were over 11,000 new cases. In Gauteng alone, nearly 7,500 new cases. It shows you the vast majority of new cases in one particular province. Dr. Freddy Kgongwana is the Acting Deputy Director General for Hospital Services in the Gauteng Department of Health. Dr. Kgongwana, good afternoon to you. I can't imagine how busy you are, so we do appreciate the time. Firstly, how are hospitals at the moment in Gauteng? Are they close to being full?
We are currently under severe pressure. The latest information is that we are at 80% plus with the kind of beds that we have designated for COVID-19 in particular. We are constantly using what we call a risk-adjusted and demand-informed strategy that hospitals will have to move into the non-COVID beds in order to respond to the COVID-19 surge, the third wave. This is exactly the same strategy that was utilized for the first wave and the second wave. The number of beds that we have allocated for COVID at the moment stands at about 3,400, but it's not a static figure. It's a dependent variable on how do we respond to the COVID-19 third wave. We are having capacity that we are functionalizing at the moment in our facilities in Bara, Krisani Bara Academic Hospital, which is we call an ABT, and in Brongospruit. Bara has got a total capacity of about 500. Brongospruit has got a total capacity of 150. Jubilee has got a total capacity of 300. George Macquarie can only take up to 150 because the total capacity is 300. We have to manage the clinical risks. And then we also have the Annular Ashanti, which is total capacity of 175. And we still have to action it, given the kind of challenges that were there and in the recent weeks. But this is the additional reserve capacity that we have to be able to mitigate the loss of Charlotte, although we would really like to have Charlotte Macquarie back on site. As you know, I say in a flotilla of warships, Charlotte Macquarie is one of our sophisticated aircraft carriers. We would really like to have Charlotte back, especially with its expertise and the fact that they were the first to really learn and teach us on how to manage COVID-19. We really love to have Charlotte back, but there's been a curveball that's been thrown at us and destabilized our plans. Because remember, we had about 800 patients that were evacuated, which means that at the time we had about 800 beds that were taken from facilities. Some of the beds were beds that were planned for the resurgence in winter, because we anticipated the resurgence in winter. As to when, we didn't know. We depended on the signs and the modelers and so on. So at the moment, we are in a very tough situation, but we're not going to despair, and we're not going to give up. Working together as a collective to fight this scourge. We depend a lot on our clinicians, both nursing and medical, the experts on the ground, to be able to advise on how do we continuously implement an incremental view of getting additional beds. There is pressure. Indeed, the extreme pressure. It is not comfortable, but we cannot panic as being in the cockpit of flying health, Gauteng. We need to land safely for the benefit of our communities, for the benefit of the dignity of our province, and for the benefit of defeating this, what I call a terrorist. COVID-19 doesn't play fair, but we cannot despair. We cannot give in.
Dr. Kgongwana, the beds that you have, are they fully functional? I mean, are they going to be able to provide people with oxygen? And with that, I mean, do you have the doctors and nurses? Because you've lost so many, we've lost so many during this time. Do you have enough staff to treat people in those beds?
Yeah, we don't have enough staff at the moment, but decisions have been made to continue with the recruitment of staff of various expertise. One had a recent engagement with colleagues who said we should also make sure we recruit physiotherapists that have been proven to be very helpful and using their expertise in managing COVID-19 as a respiratory condition. So decisions have been made to start with the recruitment of additional staff of all categories out there. We have a challenge of specialty critical care nurses. We are in competition with everyone, but we have to add staff, particularly nursing, that are, the cadre of skill that spend 24/7 with the patient more than everybody else. So we are in the process to recruit more in terms of those individuals that are there. We had communication from other stakeholders to say, no, there are doctors out there sitting at home and so on. So we want these doctors to come into the system. There's issues of interns that I had on the radio today that was raised. We want those interns to come up and join, all hands on board, so that we can be able to combat this third wave. So the provincial government has made very serious decisions to expedite the access to funding that will be able to pay these human resources. We have the beds, of course, but we need the human resources to functionalize those beds. So currently, for example, in Bahara, we have 75 of the beds out of the 500 that are currently being used. We need to optimize that access. We need to optimize that access to push it to 400. So that gives us a sense of safety, but yes, we need human beings. We need human resources to do that.
And oxygen, Dr.
And in order also to minimize, yes.
And
it also to minimize fatigue and distress on the side of our colleagues on the ground.
And then
yes,
oxygen, I'm sorry to interrupt you, and oxygen in facilities like that, I mean, you need all sorts of things to treat severe COVID-19 cases. Do you have enough oxygen and things like that in your wards?
Yeah, at the moment we have security of oxygen, particularly with the bulk tanks, because we have bi-weekly meetings with Afrox, who is the supplier of oxygen for us in the Gauteng Department of Health. We have, 2 weeks ago, we sent out a circular in collaboration with Afrox to all facilities to make sure that we have our cylinders returned on time so that Afrox can fill them and return them back to service. So we have made sure that we communicate with our facilities about oxygen. But as we speak at the moment, with the engagement that we have with Afrox, we have security of oxygen for our bulk tanks in the province, and they are being managed using a telemetric system. And we've agreed that if the tonnage goes below 50%, there has to be refilled so that we can manage the availability. We have also advised facilities that have what we call a high flow nasal oxygen not to use cylinders. They can only be utilized in a facility that have bulk oxygen supply from Afrox, not the cylinders, because it finishes your cylinders very quickly. So those are some of the advisories that we provided, and we have these bi-weekly meetings with Afrox.
My understanding is that the private hospitals in Gauteng are actually full, in some cases more than full. Are they referring patients to you?
We have a continuous engagement with our colleagues in the private sector. We have a system in Gauteng called the Medical Managers On-Call System. The abbreviation is MMOs. So every day there is an MMO who's on call, who gets communication from the private sector. But we have a system in place where referrals and transfers are doctor to doctor, because we also want to manage a situation where a patient lands in a facility, there hasn't been an arrangement with the treating doctor, and you then increase the risk of managing that patient. So even within our system of the public service, we have a referral system where if a patient has to move from let's say district hospital to a regional hospital, the doctor who is treating that individual in that hospital must speak to the doctor who's going to receive that patient in that hospital. We only come in as medical managers on call, as MMOs, where there's other conflict or people don't understand the situation. We've got what we call a diversion system in Gauteng, where we do ambulance diversions. A particular hospital will will say we are under severe pressure. Can we have some diversion of ambulances to another place so that we can reorganize ourselves? So it's a relief system. It's not a panacea for solutions, but it helps in terms of assisting particular hospitals when they call the MMO and say, look, we have pressure for medical patients. Can we have a diversion for medical patients? Then we give an instruction that any medical patients should not go to this hospital X, but they must go to the rest of the hospital so that this hospital can organize itself. So the expectation also is with our colleagues in the private sector that it has to be doctor-to-doctor referral, because especially when you also refer or transfer ICU patients, they are highly fragile patients, and somebody must be able to be ready for those patients, be able to prepare the beds and the staff that's going to receive. So we are in constant meeting with our colleagues to try and explain that we need to fit within a particular system that we have established as a public service. But there is continuous communication between ourselves and our peers and colleagues in the private sector, yes.
And Dr. Kgongwana, I mean, you've already said that, you know, the system's under intense pressure. It's a very difficult situation, over 80% full. Unfortunately, if you look at the predictions that people are making, it seems that we're actually going to have a lot more COVID-19 patients in Gauteng. You've got the ABT wards. Could it be that we might need help from other provinces? Are you worried about what the next few weeks will bring?
Indeed, we are worried about the next weeks that will bring the projected peak. We are worried about it. And that is why we're having meetings on a daily basis to check where our resources are. That is why there were very urgent decisions made today to make sure that we start recruiting. But also, the capacity of the hospital beds in Gauteng is 18,000. We have allocated, designated about 3,004 for COVID, because remember, there's also non-COVID healthcare needs, your maternity, your normal cardiac case, you know, or your emergencies that come in, surgical. So what happens as we say risk-adjusted and demand-informed strategy is, automatically you have a deferment of certain elective surgeries. Then you take over those beds. And once the peak subsides and flatten, you retake those beds back to their normal activity prior to COVID. So that's what will happen as a mitigation, because it is something that has been there in the healthcare sector even in the past. You know, when you have a certain pressure, you would defer certain activities that would not be looked at as emergency but elective. But it is a source of anxiety for us, because we didn't want to go there. We still want to manage our deferred, elective surgeries or elective medical procedures. We still want to sustain and maintain a good quality of healthcare for our communities. And also it's in the interest of the dignity of the specialists, the doctors, the nurses, the physiotherapists, everybody who's in health, for us to be able to have good outcomes of patient care. It's about life and limb. It's about saving lives and limb. It's about being places of hope for a better health outcome. So yes, we are anxious, but we cannot afford to despair. We cannot afford to just crash. We are flying this aircraft called Gauteng Department of Health. We have to not to panic within this turbulence, which is very, very severe. But we have to remain focused, and also we need, of course, prayers from everyone else of our communities, so that we get more also rejuvenated to make sure that we, at the end of the day, we have a better outcome of dealing with what I call the terrorist COVID-19, which doesn't play fair. And we also like our communities to know that this is a dangerous disease. Let's not play games with it. Let's take it very seriously and implement, those non-pharmaceutical interventions like wash your hands, or put your mask, don't go out unnecessarily, reduce your crowds, and don't go to the mall unnecessarily. Don't just be afraid, but also let's be compassionate as a community, as a citizenship.
Dr. Freddy.
Yes, we are. We are very anxious.
Dr. Freddy Kgongwana, sir, strength to you, if I may say. and to your team and to everyone working in Gauteng Health at the moment. Thank you very much indeed. Dr. Kgongwana is the Acting Deputy Director General for Hospital Services in the province